ఈ క్లాస్ పర్టికులర్గా నా సెషన్ నిద్రపోయే వాళ్ళకి మాత్రమే, నిద్ర లేచిన వాళ్ళకి లేదు. కాబట్టి నిద్రపోయిన వాళ్ళందరూ జాగ్రత్తగా ఉండాలి. సో దిస్ యాక్చువల్లీ సిన్స్ మార్నింగ్ ఇవాళ నా లెక్చర్ కొంతవరకు ఇంగ్లీష్లో చెప్పని అడిగారు. నాకు చేతనంత ఇంగ్లీష్ చెప్తాను, మీ అందరికీ కూడా అర్థమవుతుంది అనుకుంటున్నాను. వాస్తేవా? So this lecture today, since morning we are talking about arsenic album. Arsenic album in general, every symptom was covered since morning. One more symptom is there with arsenic album, that is, for example, he has to attend for a Telugu exam. He also prepares for mathematics, because in his mind always he thinks about safety. All his anxiousness and worry, everything is because of the fear and safety. In Telugu, if I tell, endukena manchidile, like that. That way he will prepare. Similarly, I also prepared something out of the subject. Go for the next slide. Yeah. In the morning, Raghavan was talking about one syndrome, GBS, right? While he was talking about that syndrome, he was telling that the reason was not known. Just I want to tell you why such syndromes are coming. See this video. Can you play the video? See, something is moving now. That is nothing but our WBC, white blood corpuscle. That is a cell in our body. It is chasing bacteria. You know, everybody of you know that WBC there in our body, and it kills the bacteria, what is there, harmful bacteria inside us, right? So this if you see that, please play that continuously. The WBC is chasing the bacteria and it's killing it, try to kill it. If you see why this GBS is coming to us, all these autoimmune disorders coming to us, is because they are, all those WBC are belonging to us who are not loving each other. We are not spreading love each other. See why the WBC should chase the bacteria? Because it is loving the body where it is living in. It is not for her sake it is doing. It is doing for the body where she is living. So similarly, if we love each other, such mentality is with us. Our bacteria, our WBC also tries to save us. Everybody wants to cheat others for our own sake. So similarly, WBC also starts that mentality living within us and tries to kill us only. So if you want to be immune from all these autoimmune disorders or GBS, TBS, whatever it is, we have to love each other. That's what Master DK says. This small example, I think, makes us, but everybody is bored of arsenic album, so I brought you WBC for you, right? I think concept is clear. And linking this arsenic album with the Bhagavatam, as everybody told, arsenic album works on every cell of our body. That's the reason, actually I wanted to play the video also, but I think Bhakta Prahlada, P. Susila was singing this, Indugaradandaledu Sandehambu Varadu. Similarly, the arsenic alb can act on every cell of our body, every nerve of our body. So it has very wide spectrum. It is not only acting on the physical body, but also it acts on all planes of our body, every plane of our body. So that's the reason we are seeing its action in all types of diseases, maybe acute and also chronic. This arsenic alb is prepared from a strong toxic substance, that is arsenic trioxide, which affects every cell of the body. Arsenic alb is one of the most powerful deep acting remedies in homeopathic medica, and this remedy is equally effective in both acute and chronic diseases. One point already has been covered, that is, start using arsenic alb only after proper training, that has been told. Generally, the problem is, I saw many people, particularly who are from colleges and treating the cases. I am seeing in initial days also, for even small cold, the first remedy they start giving arsenic album, 200 or 1 m even. But what master want there is, you get trained yourselves under a senior homeopath for several months, then you start using arsenic alb, he told. That's what Anand was telling about, not only about arsenic alb, but also about other remedies like hebar sulf, cactus, and many other remedies, right? Yeah, everybody knows about the keynote symptoms now, because since morning we are talking, but in English it was not told. So we can again talk about those symptoms. Keynote symptoms of arsenic alb are, they are very anxious. They are very neat and tidy. If we see their appearance, we can clearly pick them from the group. They are very clean. They dress very clean and neat. They appear very tidy, spotless. And also they have irresistible obsession with orderliness. That is the main problem with them. Why they have the orderliness? Because in the back of their mind, they doubt and they fear that something may happen. With that idea, they have severe obsession with orderliness. If you see the Nakswamika also we see they want everything in order. But that is because that they have back in mind that they want to prove their efficiency and work should happen efficiently. Because of that idea, Nakswamika tries to be obsessive in orderliness. And also, of course, I don't want to cover all these points because Maheshwari also should talk something. Let us go beyond this, right? And the face, if we see this arsenic alb fellow, is a little bit pale and his skin is generally cold. When not in fever, his body, if you touch, it is generally cold. And also if we see the mental state, he is very anxious. It has been everything has been told now, but anxious and restless, and he cannot sit at one place. He behaves very, very restless and he cannot sit at one place. Also, one more point which has been not covered since morning is the sensitiveness. Arsenic alb fellow is very, very sensitive, not only physically but also mentally. He is very sensitive. He is sensitive to sounds, sensitive to loud, light, and all these things. That's the reason he cannot sleep. If we see, he may go into sleep, but for every small sound and small change in the room, the AC or fan, everything, small change in the sound, very small sound also he wakes up. That's the reason he cannot sleep. Also, he has fear of disease, that already has been told. Particularly, he has fear of incurability of the disease and also he may die. He is over concerned about money, health and security. The security, safety is the core symptom of arsenic alb. Fear of being left alone, wants company, but is irritable and critical of everyone. Great fear of death, often talks about it. We'll see this in the next remedies. Arsenic alb is truly a life-saving remedy when indicated. Master E.K. advised to keep a separate life-saving kit box. That I want to just tell you to all the dispensaries. What Master E.K. told in the lectures, we have to keep a separate box with all these life-saving remedies. Whenever in emergency, if for example, if even someone comes to us or you have to go someone, we have to carry the life-saving remedy kit. That is one kit we have to maintain. Another is first aid kit. Generally, if somebody comes with injuries and all, we need not to search for those remedies. We need to have one more box for first aid. And third thing is a travel kit. For example, if someone of volunteers is moving somewhere, we need to have a travel kit. We can offer him the travel kit. He can take the travel kit and he can go to his place. These three kits we have to maintain separately apart from our regular kits. Yeah, generally the physical generals are like this. Wherever they have pain or any discomfort or any discharge, it is with burning. The burning is like fire. And also it is accompanied with severe weakness. That's what is told, disproportionate to the illness. He was telling 99 fever it may be, but he is so weak that he cannot move. Even the case of diarrhea, vomitings, whatever it is, but even for one vomiting, he gets very weak. And sudden collapse with cold sweat, alternating chills and heat, offensive smells comes from his every discharge. This is also very important point. And their modalities, everybody, I think that is, he is better by warm applications, warmth in general, but not for the head. That's what Mr. Tarakeswar has shown you a photo in which he is peeping out of a blanket. He will not cover the head, he will cover a whole body. Okay. And also he wants to wet his head because of that fiery heat, what is burning feeling, what he is getting. These are the modalities. And in general, if we see the personality traits of this fellow, he is restless, having fear of death, cannot remain still. And one more point is, they are over planners. Because of this restlessness in mind, they plan everything very overly. That means as I told you earlier, for the mathematics exam, he also prepares Telugu, physics, and also then he goes for his exam. Because I don't know, in mathematics he may ask some question from Telugu, how many alphabets are there. There may be a problem that in you have to multiply the number of alphabets in Telugu with the number of alphabets in Hindi and divided by number of alphabets in English, then you tell me. So he prepares for all three subjects. That's the way he overplans, and at last he forgets. He will put denominator as the Telugu letters where he was asked to put as English letters. So such a way he does. And he tries to manage micromanagement. He wants everything in detail. That is his problem. And irrespective of their status and position, he may be a hotel server, but he looks to be very clean and neat, tidy. And if he, for example, he cleans the table, even without our telling, he cleans the table very neatly. And he looks it back, how it is. And if he finds something there, again he will come and clean it. Such tidiness, cleanliness he maintains, not only for him, around surroundings also he will maintain cleanliness. Even at his job also. That's the reason this fellow, he wants everything in order, so always restless. That is his problem mainly. Yeah. How this fellow, how a person becomes an arsenic alb? Apart from the miasms, but because of many acute suppressions, or else after suffering some acute diseases, this fellow may go into arsenic alb. This has been told by our other friends also since morning. But to understand, for example, poisoning from insect, snake or scorpion bites, etc., wherever, only the gist of all these points is, whenever there is some poisoning in the body or septic condition is the body, when such things were suppressed earlier or treated earlier by proper treatment, maybe homeopathy or allopathy, sometimes those fellows will develop symptoms of arsenic album. They may not have arsenic album symptoms since birth. That is important. There are many such occasions had been given, even the accidents and all these things. So now coming to some examples, in the topic I have been asked to tell something about how Master E.K. told us, and from his teachings, how can we pick the arsenic alb patient. This can be told only through the examples what Master E.K. gave us. One of the example is that a student, he goes to a college, he wants to get some applicant form there. He reaches the college, even before reaching the college itself, he is trying to look through the compound wall or above the compound wall, above the gate. From here itself he is trying to know where the application forms are sold. From here itself he is asking that fellow, that cycle stand fellow, where applications are sold. Go inside, sir, you can ask that. It's a very big campus of 150 acres. How I can tell you? Which course you wanted, I don't know. Even though he keeps on asking, he He keeps on asking everyone, whoever he sees, he asks. He goes and stands in line. There again he will ask, whether is this line for this application form? Yes sir, we are all standing for the same. Again he gets doubt. He will go to the window again. Again he will ask them. That way, by the time his role comes, the applications are sold off. Such a person he is. This is one example Master E.K. told. And actually it has to be listened to his voice only, not like me. So very beautifully told. And as Trinath Rao told, the Arsenic Alb drug, 164 pages. If you really carefully go through every page, by the end of this 164, all Bhagavatam is done. Because the examples, lectures, the depth he gave, it really changes us. Such a beautiful narration has been given in these classes. I think you might have already gone through that. And the second example, this is the first example. The second example, yeah, he goes to some mela, something, some exhibitions or something. He wants to buy a ticket. First he will send his son. We'll do like this. His wife and his son went there. Everybody, three will stand there. First he will make a planning for that. I'll do one thing. You will be standing here. Boy will go and get the ticket. And he'll guide him. You have to go this way and get the ticket. And this fellow will be standing here. That boy just turns that side to go. Again he'll call him and tell something. No, while you're doing this, do this properly, give proper change, get everything he's tell. And he went there. That fellow gone. Within a minute he gets an idea. Why this fellow has not yet come? Again he asks his wife. Then wife says, he takes some time now, he has to go in the queue and he has to get the ticket. By the time he says, you do one thing. This fellow may come this side or that side. I will be standing here. You go there and stand there, that side. He will send his wife to other corner of this thing. So that she will be going. She'll go there, and this fellow is standing here. And after a while, he gets an idea. Why this fellow is not getting ticket till now? And let me check. And he'll go again to that counter. By the time son comes here. And he was searching for the mother and father. So this way, if you see, you can imagine that scene. Most of Janjala, what all pictures he made, I understand. And also Anando Brahma serial also used to come in DD that time. All those dialogues and all mostly are copied from Master E.K.'s lectures, what I understand. Most of the lectures. Most of the dialogues, what we see in these pictures and all. Similarly, this fellow does all these nonsense things. Here everything is mess. They will not get the tickets. Tickets they got, but they cannot see the show because three are wandering for each other in the same premises. So that way his planning is there. In another example, he goes to a doctor. The doctor is a friend of him. He reaches his house. From the gate itself he asks, Doctor Sahab available hai ki nahi? His doctor is there or not? So his wife politely says, yes, he is available, but he is taking bath, kindly be seated. So he sits, but only he can sit maximum 25 seconds, not minutes. Within 25 seconds, again he will ask, he completed bathing or not? The wife says, no sir, he went inside, he'll come. By the time he'll just peeping through the windows whether he has come or not. By the time his son sees, the small boy he sees, no uncle, he is still taking bath, please be seated. He understands this fellow's anxiety. So again, meanwhile, some known fellow comes into house and he goes inside directly. So he stops him. Please see whether Dr. Saab is there or not. He completed his bath or not. Tell my name, I am waiting for him. Such a way, for every small instant, he does all these nonsensical things because of out of his anxiety and unsafe things may happen. This is insecurity and all these things he behaves. This way we have to pick up. When such people coming to our dispensary also, they behave the similar way. If we have a queue of 10 people, his number may be, generally he'll come early, but while coming, he has a lot of micromanagement planning. By the time he forgets something, bringing the case sheet number or case sheet ticket and all, again he goes home. By the time he comes, his number will be the last one. So from there he will be just peeping like that. So we can just, by seeing we can understand through the examples what Master gave us. One more example I picked up from, in the night at around 9:30, Master wrote about a Nasim box there. Nasim box means I think the tobacco powder what they smell, for clearing their sinuses and all. So he observes that the Nasim box is empty. So he calls his boy around at 9:30. He tells him, giving 10 rupees, he says, okay, go and bring him. First he tells like that. Once he goes there, up to the gate, again he calls him, no, come here. If that shop is closed, go to this shop. If that shop is also closed, then go to this bazaar. That way he plans till 10:30 p.m. Because at 9:30 p.m. already it is late. He wants to give a good planning that he successfully brings that Nasim box. By the time it is 10:30 p.m. That boy leaves. And immediately asks, within 10:32, he asks his wife, boy came or not? He brought Nasim or not? And wife says, "Arey, upset. Why? He just left the house. How he can come now?" By the time 11:30 he comes without Nasim box, because the planning was done 1 hour initially. So that's all the way Arsenic Alb behaves. In every step. Similarly, this example also was told by all. He comes to a clinic. Doctor, he asks doctor, patient asks doctor, how high is my fever? Doctor says it is 102 degrees. 102, will it come down, doctor? Will it definitely come down? That's the way he asks. Doctor says, no, why not? I have already given you medicine, it will come down. So patient says, please say it once again, doctor. Please say from your mouth that it will come down. He wants assurance. That's the way he behaves. He doesn't stop. Please doctor, I have children. I have built a house. Debts are unpaid. My daughter is there for her marriage. I beg you. Already medicine has been given to him. It has been administered, but he wants the reassurance 10 times. The clinical insight, if we see, deep anxiety, we are seeing him here, and helplessness, obsessive reassurance seeking, catastrophic thinking under mild physical complaints. But a small complaint, but for him it is very magnified thing. Emotional overburdening of the physician. Master told here, if the doctor isn't strong enough, he may have to take ignitia. It is written here. If really doctor is not strong enough to handle Arsenic Alb patients, by completion of this case, he has to take 1 dose of ignitia. That's what Master told. So, Arsenic Alb trait summary is, the illness may be mild, but the fear is massive. Even after assurance, the mind races ahead in fear, seeking repeated verbal confirmation. Here, I took one case because in the topic it has been told that how we can understand an Arsenic Alb case through Organon. For that, I took a case here, sample case, in which these are general symptoms narrated by patient. Symptoms are, you all know, but just to make you understand once again, symptoms are of 3 types here. One is what has been narrated by the patient. Second is what has been narrated by their attendants or caretakers. The third thing is what has been observed by the doctor or physician. These are 3 types of symptoms in this. In this, the first patient was telling, I often feel burning pain in my head, stomach and abdomen, which worsens after eating. I have nausea and sometimes vomit after meals, and my appetite fluctuates. My stools are loose, foul smelling and burning. My hands and feet feel cold, but inside my body I feel heat and burning sensations. I am thirsty, but only for small sips of water, mostly at night. I suffer from insomnia, my sleep is disturbed. My symptoms worsen during the night, especially after midnight. I feel worse in cold weather and from cold drafts. When I sit or lie down, I feel uneasy and need to move around. I feel weak and tired with trembling limbs and palpitations. This way he was listing out his symptoms. Next, in the second slide, These are the list of symptoms observed by the caretakers. They were telling, his face often looks pale and anxious, especially at night. Sometimes he suddenly starts sweating and his hands shake visibly. During sleep, he talks to himself and appears restless, and he often wakes up multiple times at night, anxious about minor worries. He is unusually sensitive to cold and prefers warm clothes even indoors. He refuses to go to crowded places and avoids social gatherings. His mood changes quickly from sadness to irritability within minutes. He repeatedly asks the same questions and gets irritated if answers are delayed. When he sends someone on any work, he constantly doubts their return and keeps checking. His speech sometimes becomes hurried or repetitive when anxious. He talks nervously, can't stay seated for long. More particular about cleanliness and orderliness. These are the symptoms narrated by the caretaker, and the physician also observed some points here. Pulse rate is elevated during anxiety episodes. When he was anxious while talking, his pulse rate was elevated. Slight trembling of hands noted during consultation. Palpable tenderness in the epigastric region. Patient appears visibly restless during the interview. Skin dry, warm to touch in some areas. Cold extremities observed. Repeatedly asking caretakers or doctors the same questions. He dressed very clean and obsession with cleanliness. The mental behavior is very absurd, but his dress up and everything is very clean and tidy as a gentleman. Patient often trembles and shows signs of nervous exhaustion. Emotional outbursts alternating with deep sadness or hopelessness. Persistent requests for reassurance despite multiple confirmations. Physical signs include pale complexion and cold extremities. These are the observations done by the doctor. Now, if we categorize the symptoms, the mental and emotional level symptoms, if we see, they are fear of death. If we just list down all the symptoms and shortlist them into our requirements, that is mental and emotional are fear of death, restlessness, obsessive anxiety, sleep disturbance. The physical general are burning pains, thirst for small sips, vomiting, coldness of body and weakness. Modalities are worse by cold, better by warmth, worse at night. Peculiar and characteristic symptoms are restlessness, thirst for small sips, burning pains, fear of death. Here the totality, if we see, the totality is about the mental anguish, profound fear, death, obsessive thoughts and anxiety, physical suffering. They are burning pains, vomiting, cold intolerance, trembling. And behavioral traits are restlessness and repeated checking. Together, all these things put together, it is coming to be arsenic album. Because we have shortlisted only those symptoms. And now coming to the aphorisms. Here, the aphorism 6, what it is telling about, the physician should be a unprejudiced observer. So, we should not have any impressions about the patient before looking at his case sheet or anything or knowing about him. We may think that this fellow is maybe arsenic alb, this may be ignitia, this fellow may be Hahnemann, because the fellow of anxious may also looks to be like Hahnemann, also looks to be like Naxwamika sometimes, also looks to be like Argentum nitricum, and we may get confused. Without having any impressions, if really we can observe that, then in this case, following the aphorism 6, the symptoms, the physician, how he shortlisted is, the physician studied patient's feelings realistically without assumptions or bias. Weightage was not given on common symptoms or his prior experiences leads to failure. He was unbiased and focused on the actual presentation of the patient, not theories or generalizations. Generally, after treating hundreds of cases or thousands of cases, we become habituated to we judge the patients even without looking into their details. Such mentality should not be there. Here the physician, he clearly understood the patient's feelings and prepared his case sheet. Now, aphorism 7 and 8, what it is talking about? Diseases are nothing but altered state of perceptible symptoms. For this, the physician ignored speculative causes and recognized that the disease is expressed through the patient's observable changes in behavior, sensations and reactions. And aphorism 153, most striking, strange, unusual symptoms must be given importance. That has been told. Accordingly, the physician here, while the patient reported fatigue, headache, it is his peculiar restlessness, fear of death and burning with desire for warmth that directed the prescription. Here if you see, there are lots of symptoms what he has told. Like he has nausea, he has vomiting, he has headache, everything. But he took only the strange peculiar symptoms what are required for his prescription. Aphorism 211, mental symptoms are of the highest importance. So accordingly, the physician gave due weightage to the mental state, anxiety, fear, fastidiousness and restlessness, which are strongly characteristics of Arsenic Alb. And aphorism 5, it is talking about investigate the causes and maintaining causes. The physician considered that the patient's illness may have been triggered or maintained by a suppressed fear or anxiety episode which matches with the Arsenic Alb temperament. So here accordingly, without our knowledge, we will be generally doing the same thing. Because already we had been guided by masters about all the aphorisms, all the procedure of the Organon, but we have to confirm whether I am with the Organon or not. If not, generally we go by our own judgments. That should not happen. That's the reason this topic has been taken basically. Aphorism 3, know what is to be cured, what the medicine can cure and how to apply it. Accordingly, by matching the full symptom picture and Arsenic Alb's provings and clinical record, the physician fulfills the threefold knowledge required for true cure. Conclusion is that in this case, the unbiased physician filters through a flood of symptoms. Hundreds of symptoms are there. Some routine, some anxious exaggerations, and some from relatives. And through deep observation and prioritization, picks the correct symptoms that form a clear totality, guided by the aphorisms of the Organon, particularly 6, 153 and 211. The choice of Arsenic Alb becomes both rational and effective, reflecting to Hahnemann's homeopathy. This is the way we need to pick the case, and also once we pick the case, we can cross check it with the aphorisms of Organon. Of course, every time we will not do that, but it should become a habit to us. Similarly, aphorism 254, this is for the second prescription. Once we gave, for example, in this case, we gave Arsenic Alb, next he has come with some symptoms. What is aphorism 254 is telling? After this, such aspects like the appearance of new symptoms and the increase of old symptoms are to be observed. From these indications, the direction of the treatment is to be constantly observed. Some of the patients may not be able to evaluate and explain the aggravations and ameliorations in their symptoms. Some of them may not want to express these aspects even though they are able to observe them. The physician should be able to observe these aspects even in such cases. So this is like while Trinath Garu was telling about one example of that boy who was frightened with well and all. Similarly, Bujji Garu, our seniors told, one man came after taking medicines, second time, third time, he gave many times medicines, but there was no relief at all. Then Bujji Garu called him inside the room and he closed the doors. Then he took out his belt and asked him, now you tell me what you are doing. What is happening to the medicines I am giving to you? But he has confirmed from all sides. Whether you are taking medicines or not, he said, yes, I am taking, sir. Whether you are following all food restrictions, yes, sir, I am following. And he also confirmed that you are keeping them safely or not, yes, I am keeping. Once he has taken belt and he frightened him, he told, sir, till now I could not take the medicine because my grandchildren are eating these sweet pills. That way, in the second prescription, so see that confidence No one can tell. If we advise someone to, drop into the well and all what Srinadra was telling, similarly, he is so confident that he has taken belt and so let the answer card. That's what the third eye opening means. So similarly, this aphorism 254, when somebody comes now, if really he is not fully treated, arsenic alb not cured, he will not tell that I am okay. We should be an unprejudiced observer there. What we have to pick from their, report. That's what the aphorism 254 is telling. Here, the burning pain in stomach was much less, and I slept a little better. But they don't mention their anxiety. You observe less facial tension. You have observed his facial tension was less. Calmer speech, sits more steadily. That we have to observe. Interpretation is, old symptoms are ameliorating. No new symptoms have emerged. Even if the patient doesn't describe the anxiety, you notice the improvement. This means the remedy is acting curatively. This is the way we have to confirm the things from the Organon, and this should become a habit to us. It can happen only while we do regular study of the Organon and also Master's Materia Medica. If this can happen every day in our dispensaries, when the patients are present, we can take out a book and read for 10 minutes. They also can listen. That way, our volunteers, particularly we means the person who is giving medicines, we think we are already done. Master says, because of healing or what we give medicines, first the healer is healed, what he says. First the healer is healed, not the healed is healed. That means the person who is giving from medicines, he is not healed first, because we are getting healed. That's the reason to have in that particular group, we also every day we need to have that Svadhyayam of our Organon. Particularly the Organon, when someone tells about Organon, the Organon master gave is only very small book. In the market, we see 250, 350 pages of books for Organon, but it's totally confuses everyone. If someone we says go and get some Organon, it is available in Master E.K.'s library, then he says, oh, it's very small book, sir. I want to get a very big book. They'll bring one Organon of 250, 350 pages, and they get confused totally. And they'll stop practicing homeopathy and try to do from naturopathy or yoga, because they cannot do that. But Master E.K. gave so lively the Organon, so lively. Once we go through it, we become that. That's it. When we come into that state, really what is happening? That's what the last slide is talking about. Please, slide please. Before homeopathy, generally what we talk, that fellow, for example, if we see Arsenic Alb fellow or a Naxwamika fellow or a Haishamas, we say he's a liar, he doesn't have manners, he don't know how to behave, or he behaves overly. Such talks we do generally. And after understanding homeopathy, we see a deeper, expected to see, I can't say everybody is doing still now, but we are expected to see in a deeper sense, and they are not just flawed, they are patients, suffering souls needs healing. That's what the internal growth what we get. Our perspective shifts from judgment to compassion. We begin to treat, not condemn. This is the outcome of reading properly the Organon and Master's Materia Medica. The inner growth is we grow as healers. We grow as humans. We gain insight into the emotional and energetic roots of disease, and no other medical science offers this place for inner purity, transformation and forgiveness. This is the soul of homeopathy and healing. This is what Master in every lecture, that's what Trinadra was telling. If we really carefully go through Master's Arsenic Album, Naxwamika, sulfur like drugs and Natramur, Arnica, such drugs, we really transform ourselves first. We are giving medicines or not, that's a different thing. But once we go through all these things, now we really transform. That's what the outcome of going through Master E.K.'s books, and this is a great opportunity but I'll stop here for the first time. So I would like to conclude that with this learnings from Organon and materia medica, etc., etc., and we go through all these things, really this will transform us, and through us master works for healing of the patients even without giving medicines also, as if all iron pieces without any their effort, they get attracted towards the magnet. Such way the healer should transform. That's what Master E.K.'s idea, and this is an opportunity for us to recall all such ideas and refresh ourselves and our minds. Vasudeva, thanks for the opportunity.
సో మన రవిచంద్ర ఎప్పుడు మాట్లాడినా కూడా మంచి లైవ్లీ ఇవన్నీ కూడా తీసుకొస్తూ ఉంటాడు. సో సిన్స్ హీ స్పోక్ ఇన్ ఇంగ్లీష్ ఆల్ దిస్ టైమ్, ఐ ఆమ్ జస్ట్ కంక్లూడింగ్ విత్ ఫ్యూ వర్డ్స్ ఇన్ తెలుగు, ఇఫ్ ఐ ఆమ్ అలౌడ్. సో అందుకని మనకేంటంటే మాస్టర్ గారు ఇచ్చింది సింథసిస్ అని మనం గుర్తుపెట్టుకోవాలి. మనం టూ మచ్ అనాలిసిస్లోకి వెళ్ళిపోతాం, అలా పెద్ద అలవాటు మనకి. అది అట్రాక్ట్ చేస్తుంది మనని. అంటే ఒక తమాషా ఏంటంటే, ఇఫ్ ఐ విల్ బి ఎక్స్క్యూజ్డ్, ఏంటంటే ట్యూబర్కులర్ మయాజం మన ఎంత ఇది చేస్తుందంటే పెద్ద న్యూసెన్స్. మనకి మాస్టర్ గారు అసలు మాస్టర్ గారు ఆర్గనాన్ 100 times చదవాలి, 100 times మాస్టర్ గారు ఆర్గనాన్ చదవాలి. మన లైఫ్లో 100 times మన లైఫ్ సరిపోతుందండి. ఎందుకు చదవాలి అంటే, ఆర్గనాన్ చదివి పారేస్తే అలాగే ఉంటుంది మన లైఫ్. చదివి పారేయడం కాదు, మన లైఫ్లో దాన్ని ఇంప్లిమెంట్ చేస్తూ ఉండాలి. ఆర్గనాన్ డైలీ ఇట్ షుడ్ బికమ్ అవర్ పార్ట్ ఆఫ్ అవర్ లైఫ్. ఎందుకంటే మాస్టర్ గారు ఏమన్నారంటే స్క్రిప్చర్ అన్నారు, హోమియో స్క్రిప్చర్. స్క్రిప్చర్ ఏం చేస్తామండి మనం అంటే, అది మన ఇంట్లో ఉంటే పుణ్యం వస్తుందని తలకని పెట్టి నిద్రపోతుంటాం. భగవద్గీత, రామాయణం, భాగవతం అని వీ జస్ట్ కీప్ ఇట్ అండర్ అవర్ హెడ్ అండ్ స్లీప్ బికాజ్ వీ గెట్ పుణ్య. మన పుణ్యం వస్తుంది స్క్రిప్చర్ని. లేకపోతే ఏమో వినాయక చవితి నాడు, సరస్వతి పూజ నాడు అన్ని దుమ్ము దులిపేస్తుందని అక్కడ దేవుడు పెట్టి పూజ చేస్తుంటాం, దాని మీద అక్షంతలు వేసి. అంతేగాని అసలు ఆ సబ్జెక్టులకు వెళ్ళి దాన్ని మన లైఫ్లో ఉపయోగించాలనేటువంటి ప్రయత్నం చేయం. మాస్టర్ గారు ఆర్గనాన్ స్క్రిప్చర్ అన్నారు. అంటే ఆర్గనాన్ని కూడా మనం అట్లా చేస్తాం స్క్రిప్చర్. మాస్టర్ గారు చెప్పినది కాదు, దాన్ని నువ్వు రెగ్యులర్గా ఆర్గనాన్ స్టడీ చేస్తే నీకు ఆ సింథసిస్ అనేటువంటిది వస్తుంది. ఎందుకంటే హానిమన్ గారు మొత్తం ఎస్సెన్స్ అంతటినీ కూడా ఆర్గనాన్లు ఇచ్చారు. ఆ హానిమన్ గారు ఇచ్చినటువంటి ఆర్గనాన్లు ఇచ్చినటువంటి దాన్ని ఎంత బాగా దాన్ని మళ్ళీ హెర్రింగ్, కెంట్ వీళ్ళందరూ కూడా వాళ్ళ లైఫ్ అంతా కూడా దానికి చేసి డెడికేట్ చేసి వాళ్ళని తీసుకొచ్చారు. కానీ ఇప్పుడు మనం ఏం చేస్తున్నాం, కాలేజీలో చదువుకుని అది చేసి మనం ఎండీలు కూడా అవుతున్నాం, సూపర్ ఎండీలు అవుతున్నాం. హోమియోపతి, మేము హోమియోపతిలో కూడా మేము ఎండీ చేసామని ఏమైనా ఉంటే నిజమే చేయొచ్చు, తప్పు కాదు. మాస్టర్ గారే చెప్పారు, మీ నెక్స్ట్ జనరేషన్ పిల్లలందరినీ కాలేజీ పంపించండి మీరు మాకు చెప్పారు. మేము కాలేజీలో చదవలేదు, బట్ కాలేజీలో ఏం చెప్తారు అంతకంటే చాలా ఎక్కువ మాస్టర్ గారు మాకు చెప్పారు. ఈవెన్ అనాటమీ, ఫిజియాలజీ, పేథాలజీ అవన్నీ కూడా చదివాము ఆన్ పార్ విత్ ద డాక్టర్స్ హూ స్టడీ ఇన్ ద కాలేజ్. అంటే అందువల్ల మాస్టర్ గారు ఒక 2 months క్లాసులో మాస్టర్ గారు ఇచ్చినటువంటిది ఇక మా దాస్ గారు అటెండ్ అయ్యాడు. ఆయన 2 సార్లు 3 సార్లు మాస్టర్ గారి క్లాస్ని 1979లో ఫుల్గా అటెండ్ అయ్యాను. మేమందరం మాస్టర్ గారి క్లాసెస్ 2 months క్లాస్ అంటే, హోమియోపతిక్ క్లాస్ అంటే ఆర్గనానా, మెట్రియమెడికానా, లేకపోతే ఇదేంటంటే మొత్తం ఆల్ కాంప్రిహెన్సివ్. దాంట్లో హెల్త్ ప్రిన్సిపల్స్, దాంట్లో ఎన్ని ప్రిన్సిపల్స్, డైట్ గురించి ఏమిటి, ఏ డిసీజ్ అప్పుడు ఏ రకమైన డైట్ ఉండాలి, అంటే మనం ఊరికే మందిచ్చి పంపించేసేటువంటి మెడిసిన్ కాదు అది. లైవ్లీ యు ఆర్ డీలింగ్ విత్ ఏ లివింగ్ బీయింగ్ అండ్ యు ఆర్ యూజింగ్ ఏ మెడిసిన్ విచ్ ఈస్ లివింగ్ ఎంటిటీ. అంటే మన అందుకనే మాస్టర్ గారు మొట్టమొదటి చెప్పారు, మెడికల్లో నువ్వు చదివేటువంటి డ్రగ్స్ని ఒక లైఫ్లెస్ సబ్స్టెన్స్ కింద చదివామంటే నీకేం ఎక్కదన్నారు. నువ్వు ఆ మెడిసిన్ ఆ డ్రగ్ గురించి చదువుతున్నప్పుడు ఒక లివింగ్ ఎగ్జాంపుల్స్ నీ మైండ్లో తిరుగుతాయి. మాస్టర్ గారు అలా ఇచ్చారు. ఈవెన్ టుడే మాస్టర్ గారు ఇచ్చినటువంటి లెక్చర్ మనం వింటుంటే, ఆయన మెటీరియల్గా మనం వింటుంటే మనకి ఎన్నో ఎగ్జాంపుల్స్ తిరుగుతాయి మనకి. మళ్ళీ మనం బయట మనం పేషెంట్ చూసినప్పుడు వాళ్ళని చూస్తుంటే మెటీరియల్ మాస్టర్ గారు ఏం చెప్పారో రిఫ్లెక్ట్ అయ్యి కనిపిస్తుంటుంది. అలా వస్తే మనకి ఎక్కాలి. కానీ అంటే దానికి కారణం ఏంటంటే ఆర్గనాన్ బేస్ వదిలిపెట్టి మనం గ్రౌండ్ వదిలిపెట్టి ఆ కట్టసేవ చేశారన్నట్టు కాకుండా, అమ్మాయి నువ్వు వచ్చే పైకి జస్ట్ 1 minute నువ్వు స్టార్ట్ చేయాలి. ఇదివరకునే మా రవిచంద్ర కొంచెం కొన్ని నిమిషాలు ముందు వదిలేశాడు కాబట్టి ఆ వదిలేసినప్పుడు ఎందుకు సద్వినియోగం చేయాలి, మిమ్మల్ని ఎందుకు వదిలిపెట్టాలని నేను మాట్లాడుతున్నాను. వెరీ గుడ్ ఐడియా. రవిచంద్ర గారు ఇప్పుడు మంచి ఐడియా ఇచ్చారు. ఒక వాట్సాప్ గ్రూప్ ఆర్గనాన్ స్టడీకి గోయింగ్ అన్నావు. ఓకే, అది ఆర్గనాన్ గ్రూపు స్టార్ట్ చేశారు. అందుకని అందులో వాట్సాప్ గ్రూపులోకి ఎంటర్ అవ్వచ్చు, స్టడీ చేయొచ్చు. స్టడీ చేస్తూ ఉండాలి, అంతేగాని స్టడీ చేసి పారేయడం ఉండాలి. అందుకని మా అమ్మాయికి శ్రీదేవికి నేనే చెప్పాను, అమ్మాయి నువ్వు ఫుల్ ఎఫర్ట్ పెట్టి నీతో పాటు కొంతమందిని అట్లా స్టడీ చేస్తూ ఉండేవాళ్ళని చేస్తూ ఉండని. ఎందుకంటే మాస్టర్ గారు చెప్పింది లైఫ్ లాంగ్ మనం చేస్తూ ఉంటేనే మనం ఏదైనా 10 మందికి మనం సరైనటువంటిది చేయగలం. అంతేగాని ఎలా రొటీన్ దీంట్లో వెళ్ళిపోతే అసలు లైఫ్లెస్ అయిపోతుంది. అలా కాకూడదు. మాస్టర్ గారు ఎప్పుడు కూడా ఫుల్ ఆఫ్ లైఫ్, మాస్టర్ గారు ఫుల్ ఆఫ్ ఎనర్జీ. అసలు ఆయన చూస్తే మనకి ఎంత ఎనర్జీ వస్తుంది, ఎంత లైఫ్ లివింగ్ అనేటువంటి వింటుంటే అలా ఉంటాను. అటువంటి మాస్టర్ గారిది. ఓకే, వాసుదేవ.